when you think about it, if we want to look at the good things that happened during COVID, that's one of the things that happened is there is a lot of healthcare professionals that just raised our eyebrows and says, this is not right. I mean, let's face it, Jen, I probably wouldn't have met you
I know.
if it wasn't because of, and by the way, I'm looking forward to actually meeting you in person this fall. So
I can't wait either. I'm so excited.
Give our listeners and viewers some more examples of some of the corruption that goes on with Big Pharma that they wouldn't even know about. Maybe about how PBMs are involved. And I don't know how much you know about that, but I know we had a show with Robert on one time, who is also with the Wellness Company, correct?
Correct, yes.
And he's a pharmacist, and he was actually just on about FDA approvals and how there's many things that we use off label for FDA, and it's been working for years. And we had a podcast too about the corruption of the kickbacks from insurance companies and Big Pharma, and that patients are basically taken advantage of in these systems. So what else can you tell us about corruption of Big Pharma?
Well, I could talk about the MTMs, which I don't know if you guys remember those in your days.
We were basically just getting out of it when those are coming in. Okay, so thank goodness.
Yeah. Oh, yeah. What I saw and witnessed with MTMs, I was blown away. And a lot of people, they don't understand. They don't understand what was actually happening, how healthcare was being dictated by the insurance company, what medications people were being prescribed by their providers was coming from the insurance company, not from any consult a patient had with a provider. And I'll go through and break it down how this happened. So everything's electronic now. So you go to the doctor, your health record's electronic, your insurance company can see everything that you talk to your doctor about. You go to the pharmacy to get scripts, they can see which prescriptions you filled, and they can cross-reference both of those files all the time and check mark, yes, this one's compliant. This one is good. Yay, you get an A+. Oh, you got a D. You're not taking this routinely. You've got this disease state. You're not on that medication. And then the pharmacy gets a fax or an email from the insurance company and says, hey, did you guys know Jane Doe is not on a statin and she is type 1 diabetic and she is prone to get high cholesterol? And every pharmacist is like, oh, we better get her on it. We got to prevent her from getting high cholesterol. Me, I'm like, but she doesn't need it. Like, that's my first thought. Like, why would I put somebody on a medication that doesn't need it? So the typical, mainstream pharmacist would take that fax, fill it all out, and send it over to the provider. And the provider doesn't know that this is coming from the insurance company. They think you, as a good pharmacist, is making a recommendation for a medication. And so they sign away and it comes back to the pharmacy and the pharmacy's like, yay, I'm going to fill this. And they fill a medication. The patient shows up and the patient's like, I didn't know. Well, your doctor wrote it. The patient's like, okay, if the doctor wrote it, I guess I need it. They don't know what took place. The thing is this right here. The pharmacy that fills that prescription that came through an MTM gets a kickback, gets paid for doing it every time. And if you do not get a prescription out of those MTMs, you get $0. And I was constantly hounded everywhere I worked because they're like, Jen, you're not bringing in any MTMs. I'm like, I can't in good faith go out there and either write someone for a new medication. So some people are on certain blood pressure medications and a new one comes out and the insurance companies made a deal with that pharmaceutical agency. And so they said, we want to now switch this patient. We're going to pay for this medication now. And the patient's stable. Why am I going to go and recommend to the provider to change their medication regimen? I mean, you know how it is. If there's a change in manufacturer, people are like, whoa, why is a blue pill now white? People really like to see and keep things regimented. And all of a sudden now, they're like, wait, now I got a whole new med and what's going on? I mean, that's what's happening behind the scenes. And it's disgusting. And that was where I would come in and talk to people and say, listen, this is what's going on. I mean, I tried to wake so many people up when I started realizing how bad MTMs were. It was not to profit, the patient. It was only to profit and the pockets linings of the insurance companies and Big Pharma.
And it was interesting because MTM, when it was first starting out, was being sold to pharmacists about how we're going to be used, MTM, medication therapy management is what MTM stands for, and how we were finally going to be used for not just dispensing medications, but using our knowledge to help people get better and prescribe the right medications. And it's like, that's how it was sold to pharmacists. And I mean, you look back and it's just, no, we're basically pushing big pharma poisons. That's really what it was.